Here with us right now is the medical director at Park City Hospital, Dr. Wing Province. He is joining us virtually to give us insight on how things are looking at the hospital and what we can do during this holiday season to help them. Dr. Province, thanks for being here.
Thanks for having me, Christine. Good morning.
It's always great having you join our show. So how are things looking at the hospital right now?
Things are busy here. Not only do we have folks who have met their deductible and are trying to sneak in their last of the year surgeries, but we also are seeing quite a bit of COVID patients. We've certainly had a full census this whole week, and a significant proportion of those are COVID patients. So between the two of those, we've been staying really busy.
And we hear a lot about capacity. How is that at Park City Hospital? We know that this is normally during an average year, a busy time at the hospital. People are in town visiting relatives for the holidays. Also, you've got plenty of winter recreational injuries, all those things. And now on top of that with COVID, how is the ICU? How is the ER? What is the capacity looking at?
The ER has been pretty busy. I've been working throughout the week and actually just came off a shift. I'm coming off a shift right now after working overnight, and it's been pretty steady. And then as far as the census goes in the hospital, our ICU's been almost at capacity throughout the week. Our med-surg floor has also been at a high capacity as well. We still have capacity for more, but we're certainly seeing quite a few patients. Compared to last year, I'd say we haven't quite hit the numbers that we had last year. Last year was a really busy year, but our busiest week of the year is between Christmas and New Year's, and we're gearing up for that right now.
So, Dr. Province, how concerned are you about the numbers, the hospital staff being able to handle an influx of potential COVID patients as well as everything else? How are you feeling heading into this holiday season?
Well, I'm feeling pretty confident we can handle it. I always worry about the preventable sicknesses like COVID that we're seeing right now. But fortunately, we're getting a lot of our staff back that had been sick. We do have the capacity to take on the influx of patients. We've been fortunate enough to get some travel nurses from around the country who have come in to help out, as they know that we're seeing a surge now here in Utah. But our physicians are healthy, our frontline caregivers are healthy. We have the capacity, fortunately, but this is that time of year that always keeps us on our toes, because, like you said, we do get a lot of tourists, and then we're also taking care of our locals. But fortunately, we'll have the capacity to take care of both.
And in regards to COVID-19, there's quite a lot of discussion about higher death rates while there may be less infection rates. How do you perceive that?
Yeah, it's a topic of discussion quite a bit right now. As you're seeing, the numbers in our state, fortunately, are going lower as far as the number of new cases every day. However, our deaths continue to rise, and a simple explanation for that is what we've been saying for the past several months, and we can see this has happened in other states. When our college-age kids and high school kids get sick, they pass it on to their parents, or they pass it on, or we all pass it on to those who are over 65. And as a result, pretty much the damage has been done at that point. Those are the majority of the people that we see who are dying of this disease in our community and in our state, is those who are over the age of 65. And the spread has occurred to them, and that's why we continue to see death rates going up, even though the numbers are going down, because unfortunately that age group has already been affected, and now we're seeing the increased mortality rates because of that.
And on the opposite end of that spectrum is good news about the vaccine. How is that going at the Park City Hospital? Have you seen the vaccine yet? Are your physicians and frontline staff, nurses, getting vaccinated? Where are you at?
Christine, that is the light at the end of the tunnel, and we have great news to share. We actually were able to share that news yesterday evening with our caregivers, but we received the Moderna vaccine today, and we will begin vaccinating our frontline caregivers this evening. So very exciting news for so many of us who have been seeing and dealing with COVID on a regular basis, for the past 10 months. Now we're seeing the opportunity to be vaccinated and to get some of the most at-risk caregivers vaccinated. just in time for Christmas.
And I understand it can be quite emotional as these frontline workers who have been giving their all are finally able to get a little bit of hope. And it's not the only dose, though. What is the timeline for that? When do the frontline workers need that next dose, and when can they feel a little bit safer?
Yeah, it's a great question. So the second dose of the vaccine will be coming 28 days after receiving the first dose. We have to make sure that folks are, as they're so excited to come in today, we have to make sure that they're going to be around 28 days from now when they need to get the second dose. And so we're coordinating that. But we're very excited about it. It does offer us hope and protection. However, just like any other vaccine, take for example the flu vaccine in years past. It doesn't mean you're 100% immune to it. It does mean, though, that you're more likely, if you are to be infected, to have less severe symptoms or perhaps no symptoms at all. And then there's not a lot of research into whether or not it prevents people from becoming asymptomatic. That's the real issue right now, are a lot of folks who have COVID but don't realize it because they don't have any symptoms. We don't have enough data to know if the vaccine prevents that from happening. And so as a result of that, we have to continue wearing our mask, minimizing the large group gatherings, and washing our hands or sanitizing them vigilantly. Uh, the vaccine is here and it's offering us hope, but it doesn't mean we can relax on all those other public health measures.
And speaking of not relaxing, any guidance as we head into Christmas Eve, Christmas Day, the New Year's, for us to help reduce spread, stay safe, and really help everyone at the hospital be able to do their jobs?
Yes, as we learned from Thanksgiving, we saw about 10 to 14 days after that a lot of folks coming in sick, folks who were getting together with other family members, in particular college age kids who were coming home to see their parents or their grandparents. And as we predicted, 2 weeks later, there were a lot of folks who came into the emergency department who were COVID positive. So the same principle applies for Christmas. We ask that people make 2020 an exception and perhaps forego those large family gatherings, have a virtual Christmas this year. We want lots of exchange of gifts, but we don't want lots of exchange of virus. And so if folks can stay within their nuclear family and try not to get together with extended family, that will make sure that they have a happy beginning of 2021 and really decrease the burden on the healthcare system and all of us here taking care of those folks by preventing COVID spreading to those who are most vulnerable.
Really good words of advice, Dr. Wing Province. Really appreciate your time, especially after working an overnight shift at a very busy hospital. We are grateful that you're here with us, giving us real-time information about the hospital, the numbers there, COVID-19, all the things that we need to know as we head into our Christmas weekend. We'll be back with more right here on Mountain Connections right after this.